Hi, thank you so much for joining us. My name is Kari Ryman. I'm a certified nurse midwife, and today I have with me Casey Brooks. Thank you so much for being here, Casey.
Of course. Thank you so much for having me.
Dr. Casey is a doctor of chiropractic care, and she's been practicing for 4 years. She's located out of Arnold. So today we're going to talk about the wellness aspect of chiropractic care. So lots of people are familiar with going for adjustments or working with the spine or bones, but there's more to your practice, I understand, about the wellness side of things. Can you tell us a little bit about that?
Yes. So the wellness side of practice is definitely one of my favorite pieces. So we know that even with wellness, obviously the chiropractic adjustment is still the primary piece of it. But when we look at wellness, we're working more so with other pieces, which include nutrition and supplements and full lifestyle. So the nutrition piece is really working with the whole food aspect and being sure that we're getting our nutritional sources from whole foods instead of processed foods. And the other piece is, like I said, part of the supplements. So with the supplements, specifically what I utilize is the Schaefer protocol. And the Schaefer protocol is really it's a wellness protocol. Anybody can take part in it. It's anybody from preconception to pregnancy, postpartum, even individuals that don't want to have kids. It's still a really great protocol. The protocol itself has 8 pillars associated with it. And in those 8 pillars, it is the chiropractic side of things, which is the adjustment. We have essential nutrients, which that's the supplement side of things, glycosylation and hydration, whole foods, rest, movement, empowerment. And I think I hit all 8 pieces there. But each one of those has such a vast change that can happen on the body and preparing you more so for wellness instead of dealing with symptoms and trying to work through symptoms and pain and things like that. So this is more so to keep the body healthy and functioning and moving and doing the things that you're supposed to be doing.
And so you help to guide patients through understanding what they should be doing with the protocol, what supplements they need for their given situation, that type of thing.
Yes. So everybody, as far as supplementation goes, the base protocol is the same for everybody because it's truly a health protocol. So it doesn't matter if, like I said, you're preconception, if you're pregnant, it's still the exact same pieces because the supplements themselves are truly building blocks for hormones. And we all need those building blocks, whether male or female, because we all have hormones. So that's really the base of it. And we work through it in 120-day cycles. So each time that we're going through the pieces, we're doing it in 120-day chunks.
Okay, cool. And so I know that you do work with women a lot, and there's lots of people who are experiencing menstrual problems, whether it's heavy bleeding, irregular cycles, lots of cramping. So if somebody comes to your office with those concerns, what would care look like?
Oh, this is a good one. So menstrual issues are definitely a huge aspect that I work with the protocol. And this is because of the vast use of birth control that we have, that so many young women have used probably from teenage years on. And the protocol itself is to really get to the base issue of what the issues are with the menstrual cycle. So instead of just trying to, get rid of the symptoms, we're really trying to figure out what the body is trying to tell us. So with the supplements, like I had mentioned, each one of those supplements has a base piece and really providing a building block or a foundation for hormones. So as we put the patient on that and be able to work through each piece and changing for weight and all of the different things specific to them, we can see fantastic changes from, cycles getting lighter, we having no clots, we're not having the pain during periods, we're not having PMS symptoms, because truly we should have no indication that our cycle is even coming besides looking at the days. We shouldn't have, any mood changes or pain or really anything like that. So it definitely helps to level everything out and make a woman's cycle much more smooth, which is what it should be.
Yeah, so it sounds like people who are coming to you should expect it to not be a quick fix, because you're not trying to put a Band-Aid on the symptoms. You're trying to figure out what exactly is going on below it and make a permanent change. So when somebody comes with, let's say, irregular periods, how long should they expect to be in the process of working on things before they expect to see normalcy in their cycle?
So that is kind of a loaded question. So we know that with the egg specifically, it's working in 120-day cycles as far as improving egg quality and things like that. So when we're working with a woman's cycle, it takes roughly about 120 days to start to see changes. We can see small things in between, but the thing to remember is it can, quote unquote, get worse before it gets better, that it can start to become 35-day cycles instead of short cycles, or just different things can happen, but it's just the body trying to adjust and continue to make the changes that it needs.
That's like cleaning out your basement. It always gets more chaotic before it finds its way back to better. So that totally makes sense. What do you say your best piece of advice is for women that are experiencing menstrual problems?
The best thing that you can do is try to find a provider that's going to look for root cause and not just merely try to correct the symptoms. There are Schaefer protocol certified practitioners all throughout the United States and Canada, and I also believe maybe even Australia. But if anybody reaches out to me, I can always put them into contact with who's closer. There's also many doctors that also provide telehealth, which is a fantastic option. So really finding a certified practitioner would be my number one recommendation.
Sounds good. And is there anything else you would like us to know about the wellness aspect of chiropractic care? Anything that I didn't ask that you'd like to share?
I think I covered my main pieces. Really, being sure that you're just getting adjusted regularly. That is my number one thing. And everything else kind of comes with it, because the chiropractic adjustment has a full body effect from, we know, the immune system and the way that the body functions. So just getting those regular adjustments is number one.
Okay, sounds good. We really appreciate your time here, and especially because I feel like a lot of people aren't aware that there's this side of chiropractic care, that it's more than just what you see on TV, and that it really looks at the whole wellness. So I hope that women that are watching this can realize, oh, hey, that is my situation. I am having these menstrual problems, and I'd like to reach out for more information. So how would they go about finding more information about your practice or setting up maybe a telehealth visit if they're not local?
Yeah, so we have a few different options to be able to get into contact with us. So Facebook is really great. You can find us at Well Rooted Chiropractic. On Instagram, we are Well Rooted Chiro, or I'm pretty sure you can type in Well Rooted Chiropractic as well. Or our website, which is www.wellrootedchiro.com.
Sounds good. Thank you so much. And we will have links to all those things in the description below so that people can easily access you. Thank you so much for your time today. We really appreciate you talking with us.
Thank you so much, Kari, for having me.